Health experts are warning of an anticipated surge of dengue fever in North and South America. The potentially deadly disease is currently spreading across Brazil. Dengue fever is a viral infection that's spread by the Aedes aegypti mosquito that is most common in tropical and subtropical climates. Brazil has recorded more than 500,000 likely and confirmed cases. More than 400 deaths that could be linked to dengue are also under investigation. Let's bring in Dr. Albert Ko. He is a professor for the Yale School of Public Health. Dr. Ko, thank you so much for joining us. I'll tell you this, I almost died of dengue, hemorrhagic dengue, when I was 10 years old. Can't remember the symptoms. I was out for a while. Talk to us about what people should look out for. What are the symptoms? How dangerous is it?
Well, first of all, thank you very much, Lilia, for the invitation to talk about this important disease, both here in the United States, but globally. So first of all, dengue is an illness caused by a virus that's transmitted by mosquitoes, specifically the Aedes aegypti mosquito that you mentioned. Now, people usually become ill 4 to 7 days after being bit by an infected mosquito. Common symptoms are headache and body and joint pains, which often can be very severe, and a rash, which may cover large parts of the body. But what we worry most about is that the disease can cause severe complications, such as internal bleeding, shock, and even death. Infants, pregnant women, and the elderly have the highest risk, especially if they've gotten dengue the second time. Mm-hmm. And those with these with complications have warning signs, which are bleeding from the nose, gums, vomiting in the blood in the stool. So those are kind of the signs that you'd want to look for if you've gotten dengue.
I mean, something to watch to make sure to protect yourself, I'm sure, is, using a mosquito repellent, that kind of thing. But one thing that I'm curious about, I've always read that there are outbreaks of dengue fever every 3 or 4 years. Why is the problem amplified this year, and why does it work in those trends?
Yeah, so as you said, Lilia, the dengue often comes in cycles in regions where it occurs, such as Mexico, the Caribbean, Central America, and South America. This is a pretty bad year, especially in countries like in Brazil, where higher temperatures and rainfall have increased numbers of mosquitoes. The virus has been, is already circulating at high levels last year in the rest of South America. And increased travel and movement of infected people, especially coming out of the pandemic, has really contributed to the spread throughout the continents.
So interesting that there is that environmental factor. I guess the mosquito populations, of course, have something to do with the spread of the virus. I grew up in Puerto Rico in the Caribbean. It's a common place for dengue, as we were just talking about Brazil. How should people in the U.S. Be concerned about the spread of the disease, especially as you move up north?
Yeah, so specifically, people who are traveling or considering traveling to countries where outbreaks are occurring, they should be aware of the risk that may happen as they're traveling. We also have to be concerned, just as you pointed out, Lilia, growing up in Puerto Rico, there are places in the U.S. where dengue occurs regularly. And in those populations, we're certainly worried about spread and introduction of dengue there. And then we've also seen the introduction of dengue in border states, such as Texas, Florida, and California, in part because of climate change.
Wow. So, yeah, traveling populations of mosquitoes and people moving. Dr. Albert Ko, thank you so much for joining us today. Appreciate it.
Okay, thank you very much, Lilia.